So hey guys, it's Rita, and I just wanted to go ahead and do an update for you guys on the whole 6-week postpartum doctor's appointment as well as my birth control choices. So I did have my 6-week postpartum appointment and it went really quick. Not that much was discussed or done. I was weighed by the technician and I am 158 pounds, just like I told you guys previously, which is about 23 pounds, 23 to 24 pounds, excuse my math, down from what I was when I had the baby, which was 181 pounds. So they just weighed me, and then we went into the room and they checked over me. They gave me a breast exam, which went fine, and then they just gave me a vaginal exam, and she felt for my ovaries and everything, and that was all fine. They felt where my uterus was to make sure that it had went all the way back down to where it should be, and it did. They went ahead and okayed me to go ahead and begin exercising, which she said was very important, to go ahead and tighten my muscles back up. She was like, because you don't want to be one of those women who sneezes and, you know, they have an accident on themselves. She was like, you don't want that. So she told me to go ahead whenever I feel ready to start doing crunches on a daily basis to get my core tight again. She said that that was really important for me. And she did go ahead and okay me for sexual activity again, because everything was okay. Now, what I will say is that before they even did any of that, they did ask me if I had been sexually active, and that was because they were going to give me a pregnancy test. Believe it or not, there are women who will go in for their 6-week postpartum appointment and end up pregnant. I actually work with some, well, not coworkers, but clients who they, you know, might have like a 2-month-old baby and they're pregnant again, you know, a month pregnant with a 2-month-old baby, and it's just like, wow. So that is something that they do have to check for, is a pregnancy test. But no, they did not have to give me one because I was like, nope, not happening, and nothing's going on yet. So they checked for all that stuff, okayed me for all that stuff, and then of course we did talk about contraceptive, just as I discussed with you guys in a video prior, asking for your opinions. I just want to thank all of you guys for your opinions and your experiences that you left in the comments. Everybody's you know, opinions and stories and personal experience with the different contraceptive methods did go ahead and give me kind of some insight on the pros and the cons and all of that good stuff. And basically, after just talking with the doctors and the nurses, I kind of realized that, you know, all birth control options do have pros and they do have cons. There's no test that I can take to say Sharita will have this pro or Sharita will have this con, this reaction to this birth control. You know, that Sharita will react the same way to this birth control that Sarah did or Jenny did or, you know, Keisha did or whatever. There's no test. Everybody's body is different, and there's no real way to tell how I'm going to react to the birth control. So what me and my doctor decided to do after, you know, having discussion and me asking her all these questions about the different birth controls was that we decided that as a backup to natural family planning, and I'm glad that somebody actually mentioned that in the comments to my previous video. If you don't know what it is, natural family planning is basically just when you track your menstrual cycles and you track your ovulation period, things like that. You know, I realized that that is kind of like what I've done because both of my children, Kimora and Trey, were results of natural family planning. Now, I will admit Kimora was not a planned pregnancy, but why I say she's a result of natural family planning is because I used to track my cycles and my ovulation, and the day that me and Keith were intimate, let's just say, after that intimacy happened, I looked on my calendar and it blatantly said, do not have sex, ovulating, high levels, and voila, I got pregnant. And, you know, it's my fault. I just was not paying attention to my tracker. Not to say that it was, you know, anything wrong, because obviously I have a wonderful 2-year-old now and I'm very happy. But then I can also say that Trey was a result of natural family planning because he was a planned pregnancy. And after tracking my menstrual cycles and my ovulation periods, obviously we were very successful in getting pregnant, and that was only within a month of trying, so I got pregnant right away. So as a backup to natural family planning, because obviously I'm very fertile, and that was actually told to me in a conversation with one of my previous doctors before, so that conversation always just lingers in my head when I was told you're a very fertile young woman. And I don't know if there's a test to prove that, or, you know, how they really come to that conclusion that I'm such a fertile woman. But regardless, that conversation sticks in my head, obviously, and so I'm always very cautious, and I wanted to just use something as a backup. So what my doctor decided was to put me on a progesterone only birth control pill, and it's coined the mini pill, and then some other people call it pop, which basically is just like for progesterone only. And it looks like this. I will show you guys, you can see. And it says Erin. So there are lots of different name brands and then generic brands, but this one is Erin, E-R-R-I-N. You can Google it, and I'm sure that it will definitely pop up. And this is a 28-day regimen, so I will take the pill for 28 days. Now, the thing about this mini pill, this progesterone only pill, is that there are no placebos. So if you've ever taken birth control pills before, you know that you normally take, you know, your birth control pills, and then there's about a week of placebo pills, which obviously causes you to go on your cycle. Now, this does not have any placebo pills, so they all have medicine in them. And the doctor also, you know, wanted to tell me that don't be surprised if I don't have a cycle while I'm on these, because of the fact that I'm breastfeeding. Now, if you guys don't know, a lot of the times breastfeeding is also used as a natural birth control, because if you continuously breastfeed, like meaning you don't supplement formula or anything, a lot of the times you will not what's the word I'm looking for, you will not ovulate. And that's on a case-by-case basis, because I am solely breastfeeding. I am not supplementing with formula, and I actually have already ovulated. I had a menstrual cycle starting on my 5th week postpartum, and it just ended 6th week postpartum. And you know, the doctors were actually surprised when I mentioned that at my appointment, that I had already had a menstrual cycle. They said that was not the first time that they've ran into this situation, because everybody's body is different, obviously, but they did say that don't be surprised if after this cycle I don't see a cycle for a few more months or something like that, because as long as I'm breastfeeding continuously without supplementing, most likely I will not get a cycle, and then when I start these, most likely I will not get a cycle either. So after I do these, me and my doctor decided that I'm only going to do these for 3 months, and then after I do these, I am going to go ahead in January and make an appointment to go ahead and get the implant-on inserted. Yes, I did decide to go ahead and go with the implant-on, I think. And when I say I think, you know, my doctor's office, they went ahead and ordered it for me, but they did let me know, you know, to go ahead and think about it. They gave me some more information and pamphlets on it, and they said if I decided that I wanted to back out, that was okay. That just, you know, give them a call and let them know that I didn't want to keep that appointment to get it inserted, and they would just refill my pills for me. So, and, you know, this is safe with breastfeeding, as well as the implant-on is, as well as Depo is, which was another one that they, you know, were trying to get me to be interested in, but Depo was just something I was not interested in at all, just because I've just heard way too many negative things about Depo. So regardless of what anybody tells me, I just already am kind of like, So I will be taking the mini pill, and I'll be taking that for 3 months, and then in January I may get the implant-on inserted. And of course I will update you guys if in January I keep that appointment and it comes down to it. I'm still a little nervous about having something inserted in my arm, but you know, I also do really want something that can be long-term for me. I just, you know, not that another kid is not wanted or would not be a blessing if I did get pregnant, but I just really, because I believe that I am truly really fertile and I can get pregnant so easily, that I want to make sure that this child is planned and that it's the right time for my family, mentally and financially, and that time just is not now. So I don't want to have any accidents or anything like that. So with that being said, I plan on starting these pills on Sunday, which I believe is the 29th. It's actually tomorrow. It'll be the 29th of October. No, the 28th of October. And so yeah, so I will take them. I've already set an alarm in my cell phone to take them every morning when I wake up, because as you all know, with pills you want to take them the same time every day to make them effective. Also, just because you take 1 pill or 2 pills or 3 pills does not mean that you're okay and that you're protected. It will take about 2 weeks for this birth control pill to get in my system to make sure that I'm protected. So any sexual activity that I have before then, I do want to make sure that I have a backup, whether I'm using the pull-out method or whether I'm using condoms or anything like that. You just want to make sure before you have this in your system for 2 weeks, it is possible that you definitely can get pregnant. So I plan on starting this tomorrow morning. At 7 o'clock in the morning, I will have an alarm go off where I will take this pill. It'll always be next to my bed. I'm going to go ahead and open it now on camera so that you guys can see what it looks like. I don't know what it looks like either. So, alright, so they just look like this. They're just pills. There's 28 of them, a 28-day regimen. It came with just a little blue slip cover like so. And you can stick them in there like that. Okay. And then it just comes with a little medical booklet that, you know, talks to you and teaches you about how to take your medication and, you know, all the side effects and all that good stuff. So, like that. And you know what? I never, let's see. Because I was going to say, I never knew why they always include stickers in birth control packages. I've seen that before, but they, like, that have the days of the weeks on them. I never knew what those were for. Let's see, it says the tablet dispenser indicates Sunday as the day you start your pills. If you are starting the pills on any other day but Sunday, peel the attached sticker by selecting the day you plan to start. Place that sticker on the pre-printed days of the week and make sure Okay, so basically these stickers are for if you start your period any other day than Sunday. Obviously, I already knew that. If you didn't, you're supposed to always start your new birth control on a Sunday because that is the start of a new week. So, these are just basically directions for the pill. Let's see, Pregnantin pill. Yep. If you're fully breastfeeding, not giving your baby any food or formula, you may start your pills 6 weeks after delivery. If you are partially breastfeeding, giving your baby some food or formula, you should start taking the pills 3 weeks after delivery. And so that basically just goes with the whole idea, like I said, that if you're fully breastfeeding, you're most likely not ovulating. But in my situation, because I've already had a menstrual cycle, then it's kind of like, I may have ovulated, so I definitely want to get on some form of backup birth control. So yeah, you know, that is what I chose for my birth control option, as well as how my 6-week postpartum appointment went. I really don't know what else to say about this. This is a personal choice to go on birth control. My choice of using the pills and then possibly using Implanon is also a personal choice. So whether you disagree or you agree, I just kind of wanted to share this with you guys. I hope that I don't get any negative comments and that it's just all support. We're all women, we're all mothers, and we all handle things in different ways, and we all relate in different manners. So I hope that you guys can just comment if you have any questions. I will gladly answer them for you. Please subscribe to my channel if you are not already a subscriber, and please do not forget to thumbs up this video before you leave off my page. So thanks so much for watching, guys, and I hope you guys have a wonderful weekend. Alright, bye-bye.